Hey, what's going on, everyone? Drew here, back again at VCS 2017 with the IM3 booth. This time I'm joined by Dr. Tansavatdi, a facial plastic surgeon. Welcome.
Good. I'm glad to be here.
Yeah.
Thank you for pronouncing my name correctly.
Yeah, you got it. I practiced 4 times before I said it. Where are you from?
I'm from Westlake Village, California, just
cool.
a little north of Malibu.
Okay, tell us a little bit about your practice.
I am a facial plastic surgeon. I've been, this is my 5th year in practice.
Nice.
I've been practicing that long, and my main focus is primarily rhinoplasty and revision rhinoplasty.
Okay.
As well as facelift and eyelid surgery. Those are the procedures I love to do.
Beautiful. Great. So VCS, this is the 14th year that VCS has been around.
Yeah.
How many years have you come?
This is my first time.
Awesome. So
yeah.
how can you compare this conference to other ones? Since
it's amazing, except I just feel like it gets a little long. I mean, I've got to the 4th day, and I think
like it could have been 3 type thing.
It could have been 3. It could have been 3. Yeah.
But the sessions are good, or
the sessions were amazing. Probably the most I've learned at a conference.
Okay. So maybe almost like information overload then on day 4.
Yeah. On day 4, it's like some of this I've heard already. So
that's why you're here. You're like day 4. I'll just do an interview.
Yeah. Exactly.
Right on. Any favorite sessions that you attended?
God, there were so many. I learned so much stuff that's like new.
Yeah.
I would say probably the biggest ones were what things to avoid for complications. And then I found a new technique that somebody was talking about for treating white scars, which have always been for most of the literature.
What is a white scar? Is that like a keloid or?
No. So not a keloid, but a scar that's lost its pigment.
Okay.
So it's lost its pigment. So
Gotcha.
A lot of blepharoplasty scars, if people scar with a white scar, that's where it loses the pigment, and they can't hide the scar. Sometimes if you don't put makeup over it. So we have no options currently. So that was a really good talk to hear.
So it looks like there may be some options eventually?
Yeah.
Or?
So that was interesting.
That's exciting.
Yeah.
Cool. Sounds good. Awesome. Well, let's pivot here a little bit. I'm going to ask you some fun, like personal questions. Sure. Nothing too serious.
I've seen some of the questions come up. Okay.
What's your favorite color?
Gosh, that's a toss-up between green and navy blue.
Okay, we'll go with both of them. You're wearing navy blue right now.
Yeah.
You're looking good in navy blue. Are you a sports fan at all? Athlete?
I was an athlete, meaning I was cycling up until about 6 to 8 months ago, and then I crashed really big time, and I got a big scar on my face.
While cycling?
Well, yeah. I was coming down a hill, went so fast, and it just started to sprinkle that I crashed. And
over the handlebars?
Passed out, yeah.
Oh, hit your head, knocked out?
Hit my head, my helmet was cracked, and they had to life flight me because it was so far from the ER, emergency room.
Where were you?
I was up in the mountains.
Oh my gosh.
I was coming down from Mount Baldy. And
wow. So that's a
exactly.
Steep incline.
Well, they had to have enough time to get me there and do a CT scan to make sure I didn't have a head bleed.
Yeah. So did you have any like structural damage here? Did you break?
I had a little cheek fracture. But I didn't need to do anything. The funny thing is, it was really the ER doc comes to me and he goes, "I think I'm going to need a plastic surgery consultation."
And you're like, "Well, let me look in the mirror."
Wait, can you just show me my own scans? I'm a plastic surgeon.
Yeah.
So, yeah, that was fun.
So you did your own work.
No, the funny thing is my glasses broke in the fall.
Okay.
So I was kind of blind as a bat. I couldn't see the scans.
Oh, man. Well, I'm glad you're looking fine now and everything's good. And you didn't get any...
The only thing left is the scar. So
well, that'll go away. You'll be fine.
Yeah.
Use the biocorneum stuff. It works really well. I've used it.
Got to go find that
I'm
booth
a keloid healer, so I use that.
Okay.
I can connect you with a gentleman named Adam that works for them. He's really a good guy.
Can I do anything for dark scars?
Yeah, I think it takes a little while, but I'll walk you over and talk to him after this. Seriously. What's the last thing you watched on TV?
Scandal.
Scandal. Okay, I haven't watched that. I heard it's really good.
Yeah. It's a good show.
Why did you want to become a facial plastic surgeon?
That's a good question. I went into ENT first, which is ear, nose, and throat, and I just loved the anatomy.
Yeah.
But why I got into facial plastic surgery? Because I loved molding the nose. So I got fascinated with nose surgery.
Gotcha.
And what you could do with it. So.
Yeah. So can you fix this crooked?
Oh, you got a perfect nose. You don't need.
That's what doctors say. They're like, you know what? You're masculine. Women like to.
It fits you. It fits you. It's fine.
All right, cool. Thanks. That makes me feel good. All right. Do you have any unique talents outside of cycling and facial plastic surgery?
Unique talents. I gotta think about that one.
Music
I play the keyboard.
Okay, that's
I haven't
talent.
played in a little while. I love karaoke.
Awesome. So you can sing?
I can do really well if I'm under 2 beers, at least 2 beers.
Let's get 2 beers in here, guys.
But yeah, love to sing.
Awesome. What were you like in high school?
Big nerd.
Yeah.
I was a big nerd. If
what
you
kind
went
of nerd?
back,
Like valedictorian nerd or like?
No, not
like studious or.
I was studious, but I wasn't that. I was more of, Asian parents, very strict, curfew.
Gotcha.
Never went past midnight out of the house.
Okay, I got you.
That kind of nerd.
Cool. Let's see. What do we got next? What do you love most about your job?
That I get to make a difference every day. Like I get to see patients come back, and when it's transformed their life, they're just smiling and happy. And that's what you want to see, happy people.
Yeah, absolutely.
Yeah. So,
I like it. Okay, last question. If you can be any kind of animal, what animal would you be?
Tiger.
Nice. Why?
Strong, but beautiful.
Yes, I like it.
You like
cool.
That?
I like it.
Okay.
Awesome. Well, thanks for joining us.
Nice.
Thanks for sharing your story.
Nice meeting you.
Good to meet you. Have a good rest of your meeting.
Thank you.
You're welcome.
Show me to.
You're welcome. I will.
Okay.